Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery simply fails to provide the desired outcome. The result ends up with chronic pain, which is termed FBSS, failed back surgery syndrome. It is one of the most frustrating things a patient can deal with, since he or she went the surgery route hoping for a pain-free outcome, and it just didn't happen. Studies show that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than they were before. Each additional surgery that is performed has a lower chance of success than the one before. All in all, it can be exceptionally depressing. Why does it occur? Well, there are several reasons. Surgery may be performed for the wrong reason. Even the top board-certified, fellowship-trained spine professionals get the diagnosis of back pain wrong about half the time. It's simply very difficult to delineate where exactly a person's pain is coming from. It also may be that surgery is performed for the right reason, but the person was left with residual pain. Okay, so it may be a technically perfect surgery, and it just may not have gotten rid of all of it. Surgery could have been inadequately performed, misplaced screws, things like that. It could be that fusion didn't occur, either because of, the person is a smoker, the bone graft just didn't take, whatever. But the hardware ends up taking all the stresses, and it can break, and that can really increase a person's pain. It could be that the outcome was initially great, but then scar tissue formed around the nerve roots, and you have increased pain. It could be that the hardware itself is painful if it's moving around, or it could be that the levels above or below are degenerated, and that's what's causing the issue. Here's adjacent segment degeneration. You can see where these two levels that were fused, you can see the bone and bone. So that actually looks really good. The hardware looks great too. However, up here, the level that wasn't even operated on has a lot of excess bone formation and disc degeneration. See how nice this disc space looks, this rectangle? This has like nothing left. All right, so that's adjacent segment degeneration, okay? The symptoms of failed back surgery syndrome are going to differ between what exactly is going on, but it could be daily back pain, which can radiate out into the sides or into the buttock area, spasms and aching, and possibly, if there's a pinched nerve component, some leg pain and burning. Treatment options, first of all, surgery should be evaluated to see if it would help. If there's broken hardware or there's a fracture adjacent to the previous surgery, those types of things might need a procedure. Physical therapy can help, along with possibly chiropractic treatment. Spinal decompression therapy has been a great treatment. It's not indicated, though, if there's hardware in place. Acupuncture has been shown to be very helpful, along with medication management. When you look at interventional procedures for failed back surgery syndrome, there's really been an excellent advancement in the 21st century. Trigger point injections, which are very helpful. They're superficial injections, which can help with spasms and aching. Injections around the hardware can be both diagnostic and therapeutic. If they help a lot, it may be that the hardware should come out. By and large, the hardware is usually not the problem, especially if the fusion took. It just kind of becomes part of who you are. But it can also be a psychological issue for a patient, okay? Now, facet or medial branch blocks or injections around arthritic joints. It could be that for the adjacent segments that are, let's say, breaking down. An injection around the arthritic joint, which is a medial branch block, can give 3 months on average of pain relief. It can also be very diagnostic, okay? So facet and medial branch blocks are very similar. One goes into the joint, one goes around it. Epidural injections are the gold standard when there are nerves getting pinched. If there's overgrowth of soft tissue and bone above or below, it can start pinching on nerves, and that can be very helpful. And then a radiofrequency ablation is a procedure that heats up these areas around the arthritic joints, and that can provide pain relief for 18 months, definitely over a year in 85% of patients. Spinal cord stimulator implant is an excellent last resort. If surgery is not another option, if these other options have failed, a last resort is a spinal cord stimulator implant. They've dramatically improved over the last decade. They're good for both back and leg pain, with over 200 programming options available. Over 3/4 of individuals do extremely well with them. Now, keep in mind, it doesn't fix the problem, but it's a great mask over the person's pain. Okay, it's an outpatient procedure. You do have to have a trial implant placed first, but if that works well, then you can simply get the final after a psychological evaluation. Insurance does pay for these very expensive devices. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are many clinics participating, accepting over 50 insurances, and providing over 25 treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.